Trigeminal neuralgia. Trigeminal neuralgia or tic tellurix is defined as a sudden, unilateral, severe, brief, excruciating, recurring paroxysms of pain in the distribution of the branches of the trigeminal nerves, most commonly ophthalmic and maxillary division. The condition is so severe that the pain comes on slightest touch or even by the air touching the face and lasts for a few seconds to 1 to 2 minutes. On examination, there is no signs of any sensory loss. The bouts may persist for weeks or months. What's the pathology of tic tellurix or trigeminal neuralgia? There are ectopic generations of action potentials in the trigeminal nerve root just before it enters the lateral surface of the pons. Compression of the trigeminal root by increase in thickness and tortuosity of the superior cerebellar artery and demyelination as in multiple sclerosis causes generation of action potential and hyperexcitability of the pain fiber. What age does the trigeminal neuralgia occur? It usually occurs after the age of 50. Why? Because of increase in thickness and tortuosity of the blood vessel, the superior cerebellar artery that passes on the trigeminal nerve. How do you differentiate with other disorders? In temporal arteritis, there is facial pain, but there is myalgia and increase in ESR also. What if trigeminal neuralgia is bilateral? Trigeminal neuralgia in a young or when bilateral, then it may be due to multiple sclerosis and there is facial sensory loss on examination. MRI can differentiate between trigeminal neuralgia and multiple sclerosis. Tumors and mass lesion produces objective sign of sensory loss in trigeminal distribution. What are the causes of the trigeminal neuralgia? Trauma, tumor, infection, space-occupying lesions, demyelination as in multiple sclerosis, genetics, and immunodeficiency. They can cause trigeminal neuralgia. So what's the treatment of the trigeminal neuralgia? The treatment is by the first line of drug is the carbamazepine. If the carbamazepine fails, then phenytoin can be used or baclofen alone or in combination with carbamazepine and phenytoin. The clonazepam, valproate, gabapentin and lamotrigine and also oxycarbamazine. What's the mechanism of action of carbamazepine? It inactivates the voltage-gated sodium channels, so stabilizing the cell membranes. What are the side effects of carbamazepine? Bone marrow depression, aplasia, agranulocytosis, rhythm disturbances, neural tube defects, and craniofacial abnormalities in the fetus. What is the mechanism of action of phenytoin? Phenytoin also inhibits sodium channels and the voltage-gated calcium channels. And what are the side effects? Gingival hyperplasia, hirsutism, megaloblastic anemia, osteomalacia, SLE-like syndrome, bone marrow depression, and Stevens-Johnson syndrome. Why it causes megaloblastic anemia? Because it's a folate antagonist. It also causes enzyme induction of cytochrome P450, so reduction of the effects of other drugs and also its own effects. The fetal Phenytoin syndrome, characterized by cleft lip and cleft palate if used during the pregnancy. So what are the surgical treatments of the trigeminal neuralgia? Number 1, radiofrequency thermal rhizotomy, in which there is a heat lesion of the trigeminal ganglion or nerve. Recurrences occurs in 1/3 of the patients, and the side effects of this rhizotomy are numbness, jaw weakness, and keratitis due to corneal degeneration. Second procedure is gamma knife radius surgery, and that relieves the pain and more than two-thirds of the patient. And the third procedure is microvascular decompression to relieve the pressure on the trigeminal nerve. So the trigeminal neuropathy is the next topic. The trigeminal neuropathy, involvement or damage of the trigeminal nerve in certain disorder leads to trigeminal neuropathy. The causes are trauma, tumor, infection, space occupying lesion, demyelination, collagen vascular diseases, and strokes. Most patients have sensory loss on the face and weakness of the jaw muscle. Deviation of jaw on opening indicate weakness of the pterygoids on the side to which that deviates. The lateral pterygoids is the only one of them which opens the jaw. The medial pterygoid and other muscles elevate or close the jaw and move it forward or protrude. The lesions of the cavernous sinus can affect the ophthalmic and maxillary division because they pass through it. Lesions of the superior orbital fissure affects the ophthalmic division with corneal ulceration, keratitis, and loss of a blink. What's mental neuropathy? Loss of sensation over the chin can be the only manifestation of systemic malignancy. What's trismus? Tonic spasm of the muscles of mastication that occur in tetanus and patients taking phenothiazines. Which infection causes trigeminal neuropathy? Herpes infection, especially herpes zoster viral infection, leprosy, otitis media or mastitis, and Guillain-Barré syndrome and chronic meningitis may cause trigeminal neuropathy. Which drugs cause trigeminal neuropathy? Stilbemidine and trichloroethylene.